This is a case that really highlights something that I like doing. I learned this technique from Steve Charles, and I utilize it in cases where I have a pretty big retinal tear with a lot of vitreous attachment to the anterior edge of the tear. So we can see here, this patient borders on a giant retinal tear superiorly. I've done vitrectomy now over this tear, and it is just a very broad adhesion to the anterior edge of the tear. So what I'll tend to do if there's a lot of vitreous attached to the retina and I struggle to get it out even using shave modes or very low aspiration is I will go to air. I'll do a complete air fluid exchange draining through the break, and then I use the vitreous cutter under air. And this allows me not only to see the vitreous much better, it kind of condenses the vitreous down, making it more accessible. It pulls the retina and the vitreous more posteriorly away from the lens if it's a phakic patient. And I feel like it allows me to have a much more thorough vitrectomy. Give it a try.